I truly feel for doctors, nurses and general staff who are working in the NHS as having just got over the first wave of the pandemic, while they're looking at the issues they normally face during the autumn and winter months. They also have to deal with the second wave, and if that isn't enough, Boris Johnson's government has informed them to start preparing for a potential No Deal Brexit. Hospital chief executives all across England have been put on alert and told to get the NHS ready for massive disruption following the end of the Brexit transition period. Hospitals were charged with appointing a senior responsible officer for no deal preparations. This was in a letter sent to them by Professor Keith Willett, who is the NHS official responsible for Brexit planning. So we heard Michael Gove during the week talk about his worst case scenario. Well, in it he warned of significant disruption at the border. Healthcare experts are warning of a risk of shortages of vital medicines. Professor Willett was in charge of the emergency planning during the pandemic. He resumed that job recently. It looks like he'll be a very busy man, as he'll be both in charge of planning to deal with the current crisis as well as what will unfurl in January. Why is this planning necessary? Well, because the UK gets 3/4 of its medicines and 90% of its medical devices from or through the EU single market, the single market that Brexiteers have been adamant about leaving. Last month I uploaded a video about how medical suppliers were asked by the government to stockpile for Brexit, but many have said that it's frankly impossible considering the limitations that exist due to the pandemic. Many companies are also afraid of a second wave that will eat into any stockpiles they currently have. Such short notice to restock warehouses for December is beyond unreasonable. The NHS Confederation has continued to lobby for protections for the NHS during the Brexit negotiations. They've asked the government to protect public health and well-being across the UK and the EU. The Brexit Health Alliance has been campaigning to ensure that the UK can continue to participate in key EU data sharing platforms and alert systems to exchange information and early warnings about healthcare threats. They also support importing and exporting of medicines and medical devices that are needed so that they can reach patients as quickly as possible. This relies on a minimum of delays caused by both tariffs and regulatory barriers. They believe it's also important for the NHS to be able to participate fully in research and testing of new treatments, including clinical trials, so that patients can benefit as soon as these become available. Also for the NHS, it's important to recruit and retain the researchers needed to staff services. The issue of immigration is vitally important to the NHS, as they rely on massive numbers of people coming from abroad to maintain the system. As I've said before, an extension to the transition period during the pandemic should have been requested, but Boris Johnson was too cowardly to do so. He was afraid of a rebellion from his backbenchers. A deal still could be worked out, but it also makes sense for the NHS to prepare for the worst. However, this is going to cost money, time and resources. Brexit will result in more money down the drain, which will mean a lower level of service from the NHS to those who truly need it. It's almost as if the Tories, who have underfunded the health service for the last 10 years, want it to collapse. Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot. I want to say a big thank you to all of my patrons. You ensure that this channel continues to exist. I'm eternally grateful for all of your support. If you join Patreon, you will receive instant access to our Discord server, where we have both audio and video chats. You can chat with me and other patrons, where we discuss important and non-important issues. Becoming a patron per month costs about the same as a large coffee, so why not check it out?